individual, and also the small variability of each individual that will actually determine how that person, a particular person, not a population, to react a particular drug treatment. So that's what we talk about. Once again, this is personalized medicine, and by using the molecular-based testing, and now we call it individualized molecular testing, we are able to help physicians to basically carry out personalized health care and personalized medicine.
So you have to create these individualized molecular tests and carry on. Can you explain a little bit more about the tests?
Yeah, I can give you a few examples, and in terms of how we can use SNPs or some other genetic alteration, and how they're going to impact the patient care or treatment. For example, we talk about a small gene variation like a SNPs could have a quite significant outcome. And one thing we know, for example, the factor V genetic variability, or some people call it latent variation, and that actually could inhibit one of the particular protein, and actually going to affect a particular person or a patient's anticoagulation. And that actually is due to, now we know, is because of one single base pair translation from the G to A. So it's just one nucleotide change that makes a huge difference. And another one, everyone familiar, cystic fibrosis.
Yes.
And this is there's some genetic predisposition of many people, not many people, certain people, and one of them is a deletion. We call it delta of 508. And this one single, one deletion at the 508, and there is actually it's a 3 base pair deletion, and that actually have a very severe cost to a particular patient, or the probability to develop later on lung cancer, for example.
Now, we have a lot of terminology when we talk about personalized medicine about various omics and gnostics, and in fact we have a show called Genomic Medicine. Can you explain a little bit some of these terms and how they're used in the field?
Yeah, that's actually a very good question. And now let's talk about individualized molecular testing for personalized medicine. This is I want to have a little disclaimer here. This is my personal understanding, and this has not yet been very well accepted in the field, but I strong believe that because of the technology is so advanced, and now we should think about, instead of just call the entire field of pharmacogenomics, because of the way we carry out the diagnostic test, because the sort of the strategy is different depending upon what we're talking about. So now I actually propose we can divide further, categorize this into 3 subcategories. And let me explain. The first term, called theragnostics. And theragnostics, you basically, by just looking at the term, is you combine an individualized molecular test directly with the therapy. And let me put it in a simple way.
Okay.
Essentially, by using the result of this type of test, we can help physicians to choose a particular drug. So that's what we call, so basically it's a yes or no question. Yes, can we use this drug, or no, we cannot use this drug. So that's what we call the theragnostics. Will
this cover also companion diagnostics, the diagnostic tests that are used to do exactly that? Just
companion diagnostic, yes. So companion diagnostic essentially, yes, it will be in this category of theragnostics, and later on when I talk about pharmacogenomics,
okay,
it's also in that category. Basically, that terminology some people also call the synergistic diagnostics. Essentially, if you, as a doctor, if you prescribe a medicine, and the best hope, if there is a molecular diagnostic test that can help the physician to choose or not choose that drug, or to make the the right correct dosing or prescribe the correct dosing of that drug. That's what we call a companion diagnostic or synergistic diagnostics.
Okay.
But the way I'm talking about here now is, as I said, theragnostics is to using the molecular diagnostic test result to help the physician to choose select or not select a particular drug. Now, let's talk about the second terminology. It's called pharmacogenomics. Everyone familiar with this technology and have been used in a very wild sort of interpretation. Essentially, now we talk about personalized medicine, and some people talk about pharmacogenomics. Basically, when you're using a genetic information in general, we call it as a pharmacogenomics. But here, I propose to further refine this in relevant to prognostics, and later on we introduce the third term, prognostics. And here, basically, we're talking about using a molecular-based testing or individualized molecular-based testing to help the physician to adjust the dose, so he or she can prescribe the right dosing for a disease treatment or a condition. And now there's a third term I can give you example of each after we give our audience this sort of a terminology first. The third term is called prognomics. If you can, so here we go, is our prognomics, but just looking at it, essentially we are using the genetic information and this will combine, for example, a molecular profiling, a single gene or a group of genes, sometimes we call it array, along with bioinformatics and a statistical model to actually determine the outcome of prognosis of a particular disease or a condition. So there's a three term. I hope our audience sitting in front of this TV, and I hope really this is my hope, the take-home lesson, if you listen and if you can take home this three term and know what they are, and I really feel very grateful.
Well, this is very interesting. So since we talked about theragnostics, and you indicated that this term covers methods to help physicians to pick up the right drug, okay? How many types of such tests you think are right now on the market, and can you give us an example so we can understand better the term?
Absolutely. That's an excellent suggestion. If you look at the literature now, and there are many publications suggesting and certain tests can be used for this purpose, for help physician to choose a particular drug therapy. And let me give, and I just mentioned a few. For example, KRAS and a BRAF mutation analysis. Now we can use this for anti-colon cancer therapy or a non-small cell lung cancer therapy. And also, for example, in HIV treatment, and there is a particular drug called Ambicvir. Some patients, those people who carry this HLA 5701 haplotype, and they cannot take this drug because they will develop high sensitivity. And for treatment of leukemia, for example, there is a gene mutation called FLIP3. And if a patient have this mutation, you cannot treat the patient with a certain drug like Cefalon. And another one, obesity, for example. Some people want to take some drug to lower the body weight, but not everyone can take the same drug. And for example, one example we know now, the ApoE gene